Hello everyone, hope all of you fine and doing well. I'm Dr. Yaldon Azari, second master student of Al-Farabi University, and this presentation is about the histology of female reproductive system. The contents that I will explain you in this presentation, the first topic is about the structural elements of the organs of female reproductive system. The second one is about the features of the oogenesis, and the third one is about the endocrine function of the ovary. The fourth one is about the tissue composition and membrane of the oviduct, and the final topic is about the microscopic anatomy of portion of female urinary system. At first, I want to introduce the female reproductive system. Female reproductive system including the following organs: two ovaries, two oviducts that also called fallopian tube and uterine tubes, uterus, vagina, and external genital. That each of these organs, step by step, I will explain you in the next slides. There is a pictures of internal female reproductive system and external female reproductive system. In this picture, you can see the uterus, fallopian tube, ovary, and also the vagina and vulva. That is the external genital, and also you can see the urinary system that including the bladder and uterine corpus, and the external reproductive system you can see in these two pictures. Structure of the ovary. Now I want to explain you what is ovary and what is the histological form of ovary. As you know that ovaries are a small almond shape that lying, or it is located in the pelvic cavity. The surface of epithelium is a simple cuboidal that known as a germinal epithelium, or we can say that ovary are covered by a modified mesothelium that called germinal epithelium. And this mesothelial covering is a simple cuboidal epithelium in young women, and becomes a simple squamous epithelium in older woman. Just below the germinal epithelium or under the germinal epithelium, there is a poorly defined region of dense connective tissues that is called tunica albuginea of the ovary. And this tunica albuginea also present in the testes and penis of males, and also these tunicas have the same development derivation in the gonads of males and females. The ovary can divide it into two parts: the stroma and the branchium of the ovary. And the branchium of the ovary can be divided into two components. The first one is cortex, and the second one is medulla. This is a picture that shows you the germinal epithelium that cover the ovary, and also there is some follicles that are located in the cortex, and also there is the cortical stroma of the ovary. At first, I want to explain you about the cortex of the ovary. As you know that the cortex of the ovary contains the follicles that are surrounded by a primitive connective tissues composed of spindle shaped fibroblast, and these follicles are spheral structures that are each composed of somatic cells, and these somatic cells also called follicle cells that are surrounded and hosted. In addition to spindle shaped fibroblast, the stroma of the cortex also contains collagen and reticular fibers. And also the cortex has closely packed spindle shaped like cells which are arranged in a whorl-like pattern. And what is medulla? Medulla contains stromal cells identical to those which are in the cortex, and also medulla contains blood vessels, including arteries and veins, and nerves, and dense stroma of supporting tissue. The blood vessels and nerve enter and leave the ovary through a helix of connective tissues, and these helix cells also identical to Leydig cells and may contain Renex crystalloids. In this picture, you see the ovary, cortex of ovary, medulla, and ileus. As I explained you that here the vein and the artery enter and leave the ovary through this ileus, and also this shows the cortex. As I explained that cortex contains the follicles. You can see follicles in the cortex, and there is the stroma of the cortex. In here you see cortex and the surface of epithelium. Okay, what is the function of stroma? Stroma provides structural support and forms tecointerne and tecoexterne around the follicles, and also it secretes steroid hormone. There are three types of stromal steroid that secreting cells. The first one is scattered luteinized stromal cells which are numerous during the pregnancy. The second one is stromal cells that form tecolayers, and the third one is enzymically active stromal cells which are numerous in postmenopausal women and secrete testosterone. Ovarian follicles are located in the cortex, and they are surrounded by stromal cells. A follicle consists of an oocyte and surrounded by one or more layers of follicular cells or granulosa cells. At puberty, two ovaries of puberty person or of a young adult person or female have about 400,000 follicles, and most of them are degenerated or atresia. And from these 400,000 of follicles, about 450 follicles will cycle to ovulation in a lifetime. Now, I want to say that the type of ovarian follicles, according to morphological characteristic, follicles can be categorized into three types. But in some books, they categorize it into four types. In here, I explain you the three type of ovarian follicles, and these are including the primordial follicles, growing follicles, and mature follicles or tertiary follicles. And in some books that they categorize it in four types. These are including primordial follicles, primary follicles, secondary follicle, and mature follicles. But here, under the growing follicles, we have three subtypes of follicles that are including the unilaminar primary follicle, multilaminar primary follicles, and secondary follicles. It means that primary and secondary is under the growing follicles. In this picture, you see the ovaries and the four type of follicles: primary follicles, primordial follicles, primary follicles, multilaminar primary follicles, secondary follicles, and at the end, the Graafian follicles or mature follicles. Now I want to explain these four types or these three types of follicles. At first, I want to explain you about the primordial follicles. Primordial follicles is a follicles that contain a primary oocyte, and also enter the prophase of first meiotic division. One layer of flattened follicle cells. It is a one layer flattened cells. It is not completed, and it's surrounded a central oocyte or immature hex. And these follicles are located just under the tunica albuginea and form form groups of primordial follicles that calls eggs. The oocyte diameter is about 40 micrometer, and at the time of birth there is 1 million eggs, and at the onset of the puberty the number reduced to about quarter of a million. And you can see in this picture the primordial follicle that has just one layer of follicle, and in the central of the this layer is oocyte that is immature egg. This is another picture that shows you the one layer follicle around the oocyte, and oocyte is in the central of the follicle. This is also another picture. It shows oocyte. These are the follicular cells, and these are the primary follicle. It's called primary follicle. What is growing follicles? In growing follicles, the oocyte diameter increase to 100 to 150 micrometer, or we can say the average is about 120 micrometer. In this stage, nucleus enlarged and called germinal vesicle. Also, organelles increase in number and amount, including mitochondria, several Golgi complex, and also reticuloendothelial ribosome or free ribosome. Follicular cells become cuboidal, and unilaminar primary follicles in this which as one layer of the cuboidal follicle cells, and multilaminar primary follicle as several layers of follicle or granulosal cells. In this type of ovarian follicles, zona pellucida secreted by oocyte, and it is composed of 3 glycoprotein. And this zona pellucida just form outside the oocyte membrane and take the basal lamina. Follicle cell philopodia extend into zona pellucida, as do oocyte microvilli, and these follicles are joined by gum junction. Stromal cells differentiated into theca follicle that has a theca interna and a theca externa. And a thecan basal lamina separated theca interna from granulosa cells. In this picture, you can see the primary follicle and also secondary follicle. You also can compare these two type of follicle. You see that in here just there is a one layer of follicle around the oocyte. Here you can see that oocyte secretes zona pellucida, and there are more than one layer of follicle around the oocyte that surrounded the oocyte. This is another picture. You can see the zona pellucida and also the zona pellucida that take the basal membrane, and there is more than one layer of follicles around the oocyte. Secondary follicle, that is secondary follicle. Secondary follicles also called an antral or vesicular follicle, and they consist of 8 to 12 of layers of follicle cells that surrounded the central oocyte. And also a major characteristic of these follicles are fluid-filled space that form between some of the layers of follicle cells, and these space will enlarge and fuse with each other to form the antrum of the mature follicle. This follicle is identifiable, and they consist of two major stratified layers of cells that are derived from the stromal cells, and these layers are the theca interna and the theca externa. Also, a single layer of granulosa cells that immediately surrounded the primary oocyte is known as a chronoradiator, and it shows in the secondary follicles. And most of follicle at this stage become arthritic, and some granulosa cells of arthritic follicles do not degenerate and form interstitial glands which secrete androgens. This is the picture that shows you the antrum. As I explained you that fluid fill a space in granulosa layer fused to form the antrum that it shows in mature follicle, and also it shows the corona radiata that I explained you that it is a single layer of granulosa cells that surround the primary oocyte. You see that it surround the primary oocyte, and it shows the zona pellucida that's secreted by oocyte. Also, these are also zona pellucida. This is another picture of secondary follicle, here you see primary follicle and secondary follicle. You see that there is more than one layer of follicles. And also in this picture you can see the zona pellucida, oocyte, and antrum. What is tertiary or Graafian follicle? It also called mature follicle, Graafian follicles, and tertiary follicles. Mature follicles develops due to continued proliferation of granulosa cells and it production of more liquor follicle which undergo ovulation, and it has a well developed antrum filled with a fluid that called liquor follicle or follicular liquor. Oocyte located within a hillock of multiple layers of follicle cells that projects into the antral cavity, and it called the cumulus ophorosis. And the follicle cells directly adjacent to oocyte from the corona radiata that will remain associated with oocyte after ovulation. In this, because of continued formation of liquor follicle and colmus ophorus detach and float freely in liquor follicle. This is the picture that it shows a tertiary follicles of the ovarian. Also, this is another picture that here you can see that this bulging and antrum and cumulus of ophorosis. Oocyte meiotic division. What is oocyte meiotic division? First meiotic division occurs just prior to ovulation under the influence of meiosis inducing factor, and second meiotic division begins and stops at metaphase, and second meiotic division is completed after fertilization. Ovulation when occur after the fluid pressure builds up until follicle ruptures due to formation of proteoglycans and hyaluronic acid and attraction of water. And before ovulation, the surface of ovary lose its blood supply, and just the follicle pressing it and known as a stigma. Follicular connective tissues broken down and by proteosis. The ovum or the secondary oocyte is driven into open end of oviduct or fallopian tube, and the ovum remains viable about 24 hours after ovulation, and the remnants of Graafian follicle are converted to corpus hemorrhagicum. So if we define corpus hemorrhagicum, we can say that after ovulation, the remainder of follicle collapses and some rupture blood vessels leak into follicular cavity, and it forming a clot that is known as a corpus hemorrhagicum. What is corpus luteum? Corpus luteum, after the removing the clot by phagocytosis, a temporary hormone secreting structure formed by granulosa cells that and tecointernal cells, and it's known as a corpus luteum. Granulosa cells hypertrophy into the large pellucinin granulosa lutein cells with organelles necessary for steroid production, and they constitute about 80% of the cells of corpus luteum. These cells produce some hormones including progesterone and androgen, and also androgen produced by tecolutein cells into estrogens. Granulosa lutein cells increase in size about 20 to 35 meter in diameter, and also they are called granulosa lutein cells and increase the production of estradiol. What is theca cells? Theca internal cells form theca cells, and these cells are smaller and darker than granulosa lutein cells, and they become aggregated in the folds of the corpus luteum, which become vascularized like other endocrine glands. These cells produce progesterone and androstenedione under the effect of LH, and also if next to the patient pregnancy doesn't occur, corpus luteum of menstruation survives only 10 to 14 days, and if pregnancy occur, it enlarged greatly due to ECG hormone at lasted 6 months, and this called corpus luteum of pregnancy. And corpus luteum of pregnancy grows about to 5 centimeter diameter. In here, you can see the corpus luteum and the vascularization of corpus luteum and also the granulosa cells. The fat of corpus luteum it depends on the possibility of pregnancy. Oil levels of LH stimulate the corpus luteum to secrete progesterone for 10 to 12 days, and in the absence of progesterone, corpus luteum goes under to apoptosis, and progesterone levels are decreased, and it leads to menstruation. There also you can see the corpus luteum and corpus and luteum cells. What is corpus albicans? Corpus albicans, when the corpus luteum degenerated, it is invaded by fibroblast, which manufactures collagen type 1 and form a fibrous structure that known as a corpus albicans. Large ones form after pregnancy and smaller ones form after each ovulation. And on the surface of ovary, remains of corpus albicans is visible as a scar. So these slides that I explained, it was about the ovaries and the oogenesis process. Now the second organ of the female reproductive system is oviduct. Oviduct, also called the fallopian tube and also called the uterine tube. It is a muscular tube that long 12 centimeter, and it is the site of fertilization. Upper end opens into peritoneal cavity and near the ovary, and lower end passes through the uterus wall. Oviduct has 4 segments, including intramural part that is in uterine wall. Isthmus is adjacent to uterine wall. Ampulla is the dilated part of oviduct, and infundibulum, that is a funnel-shaped part near the ovary with fimbrium. Point that all of you should note, it is about the fimbrium, that fimbrium is near the ovary. It is not connected to the ovary, and its function is just taking the egg from the ovary and transmit it to the oviduct and to the uterus. This is a picture that shows you the structure of the oviduct. Here it is interstitial of the ovary, isthmus. There is the ampulla, the dilated, and there is the infundibulum and fimbrium. Oviduct has 3-layer mucosa and muscularis and serous or adventitia. It is the layer of the oviduct. The mucosa has many longitudinal folds which are pronounced in the ampulla, and also it has a simple columnar epithelium that consists of ciliated cells and non-ciliated pitch, and also ciliated ciliated cells are numerous near ovarian and end of the tube. Also, it has peg cells. Peg cells are secretory cells that produce a watery tube fluid that contains normal serum protein, chloride, and potassium ions. And these cilia are near ovary, beat toward uterus, but cilia near uterus beat towards the ovary. And also another layer of the or composed of the mucosa is lamina propria that composed of loose connective tissues. The second layer of oviduct is muscularis. Muscularis consists of poorly defined inner circular layer and outer longitudinal layer of smooth muscles cells, and also muscularis peristaltic movement with the beating of the cilia of epithelium help to propel oocyte to the uterus. It means that the embryo takes the eggs, and because of this peristaltic movement, it help to propel oocyte to the uterus. And the third layer of oviduct is serosa, and it composed of visceral peritoneum, and also it is a connective tissue layer lined by a simple squamous epithelium that contains blood vessels and nerves. This is a picture that shows the oviduct and the layer of oviduct. Uterus is another organs of the female reproductive system, and it is a pear-shaped structure that attached to oviducts at upper end and to vagina at lower end. Uterus is divided into three regions. One is fundus, body, and cervix. The fundus is a dome-shaped part of the body. The cervix is the lower part of the uterus, and it ended in the vagina. Wall of body and fundus has three layers, including endometrium, myometrium, and adventitia or serosa. The endometrium, myometrium, and serosa is a three layer of the body, wall of the body, and in this picture you can see this three layer. Endometrium is the inner layer, myometrium is the thickest layer and middle layer, and adventitia is the outer layer. Anterior portion of body covered by adventitia, which is composed of areolar connective tissues, and the remaining portion of uterus covered by serosa, composed of a layer of simple squamous cell or mesothelium at resting on an areolar connective tissue. Endometrium is the, or we can see the mucosa. It is a mucosal lining of uterus composed of a simple columnar epithelium. It has ciliated columnar cells and secretory columnar cells. Lamina propria composed of dense irregular connective tissue and vessels support epithelium and house simple tubular glands, and the glands have not ciliated cells. Endometrium, as I said, that it has two layers, functional layers and basal layers. Functional layers are superficial layer, and it goes during the menstruation under cyclic changes during the menstruation. And basal layer, it is the deeper and adjacent to the myometrium, and it remains mostly unchanged during the menstruation. Or in the summary, we can say that endometrium covered by epithelial cells, partly ciliated, and contains simple tubular glands, and also the lamina propria is rich in fibroblasts, and the endometrium has these two layers, functional layer and basal layers. Myometrium is the second layer of the uterus. This is the thickest layer of the uterus and composed of four poorly defined layers of smooth muscle that separated by connective tissues. The inner and outer layers, or we can say the first and fourth layers, are longitudinal. It means that parallel to the long axis of the uterus. And the middle layers, or we can say the second and third layers, are contain circular and oblique fibers, as well as large blood vessels that consist of mostly circular that arranged bundle of smooth muscle cells. Arcuate arteries located in this layer of the uterus, and also it is known as a stratum vascular. Middle layers taken during pregnancy with more and large smooth muscles cells. It means that hyperplasia and hypertrophy and increased collagen fibers. Myometrium is estrogen dependent and absent of estrogen. Smooth muscle cells atrophy, and some of them begin to apoptosis. This is a picture that shows the myometrium and the thickest layer of the uterus. Serozorat adventitia, it is the outer layer of uterus, and it consists of connective tissues and peritoneal mesothelium. Okay, what is the cervix of the uterus or uterine cervix? It is the lower part of the uterus that ended into a vagina, and it is lined by mucosa secreting simple columnar epithelium. The part of cervix which is in the upper vagina has stratified squamous non-keratinized epithelium, and the lamina propria of cervix composed of mostly dense connective tissue, and it contains of many elastic fibers and a few smooth muscles cells. The cervix mucosa do not slow off during menstruation, and the cervical mucus contains branched cervical glands. At the time of ovulation, cervical glands secrete a serous fluid, and at other time the secretion become viscous, and during pregnancy it form a plaque. Softening of cervix during parturition is due to lysis of collagen. Vagina, it is a thick stratified squamous non-keratinized epithelium lines the vagina mucosa. Estrogen stimulates epithelium to synthesis glycogen, and the mucosa of vagina has not glands, but it increment of fluid during sexual arousal, and it is this secretion is due to transudat from vessels of lamina propria and secretion of cervical glands. It means that vagina doesn't have any glands. The muscular layer of circular and aporo longitudinal smooth muscles fiber, and also the adventitia of dense or irregular connective tissues with elastic fibers and many vessels and waist, venous, plexus, and nerves. This is also the picture of the vagina that shows the muscular layer and the mucosal layer. External genital is the another organ of the female reproductive system, and it consists of mons pubis, labia major, labia minor, clitorius, Bartholin's glands, minor vestibular glands, and hymen. Mons pubis is the overlying symphysis pubis that covered by skin, and it is under it is the pad of fat, labia major or skin folds with an adipose core and a thin layer of smooth muscles, and the skin of labia major course here on their external surface, sweet and sebaceous gland as many nerve fibers, and labina minor are folds of skin, but there is no ear and with core of spongy connective tissues with elastic fibers. Skin with sebaceous and sweet glands and many nerve fibers are located here. Clitorius is a embryonic log of penis, and it contains two erectile tissue bodies and covered by stratified squamous epithelium, and it is heavily innervated. Bartholin glands are mucus-secreting glands which ducts opening into the vestibule of vagina, and if its duct doesn't open, it can cause some disease, or it can cause anhopsis that called Bartholin hopsis. Minor vestibule glands are also open into vestibule, and at the end the oiman is also a tenfold of epithelially. It includes fibrovascular and connective tissues that narrow the orifice of vagina in virgin. Okay, the last topic is about the urinary system. Urinary system, also known as the renal system or urinary tract, and it consists of the kidney, ureters, bladder, and urethra. And according to microanatomy, it's covered in an unique lining that called urothelium, and it is same to transitional epithelium, and transitional epithelium can flatten and dighten this system, and also urothelium covers most of the urinary system, including the renal pelvis and also the ureters and bladder. The female urethra, the length of female urethra is about 5 centimeter in length, and also it's lined by transitional epithelium, and it is near the bladder and stratified squamous non-keratinized in a remainder portion. Patches of pseudo stratified columnar is interspersed, and also lamina-propria of urethra is fibroblastic connective tissues, and the mucosa secreting glands of lateral numerous along its length, and also the muscular layer is composed of an outer circular and inner longitudinal smooth muscles fibers, and when a urethra pierce urogenital diaphragm, a sphincter of skeletal muscle surrounded it. Okay, thank you. This was the presentation that I explained you the histology of ovary, oviduct, and also the uterus, and a very brief introduction about the microscopic anatomy of urinary system. If you have any question, you can put your question in the box, and I will answer the questions. Thank you so much for your attention.